The tooth primarily consists of two parts: the dental crown and the tooth root. The visible part of the tooth in the mouth is the dental crown. The part of the tooth that is not visible in the gum and jawbone is the tooth root. The internal structure of the tooth consists of different layers. They are enamel, dentin, pulp, and cementum. Let's get to know the properties and structures of these layers. Enamel. Tooth enamel is the hardest substance in the human body. Tooth enamel is a protective barrier that surrounds the crown, which is the visible part of the tooth. It is resistant to bacteria that cause decay. Enamel consists of strong minerals, including calcium phosphate. Due to its mineral composition, tooth enamel is translucent. Tooth enamel does not contain nerves. Since it has no nerve cells, it is not sensitive. Tooth enamel has protective properties inside the mouth. Our teeth are exposed to many foods and external factors during the day. Tooth enamel protects the tooth against these factors and prevents harmful factors from reaching the inner layers. Although enamel is hard, it can be damaged by external factors. Dentin. Dentin, made of living cellular matter and tissue, is the structure that makes up the majority of tooth structure. It is the layer beneath the enamel. Its structure is softer than enamel, but it has a harder structure than bone. The structure that gives teeth their color is dentin. The outer periphery of the tooth pulp is surrounded by dentin-forming cells. These cells are like castle guards that protect the tooth against decay and other harmful factors. If dentin-forming cells prevail against caries that occur for any reason, these cells plaster the tooth pulp castle with dentin. On the contrary, if it succumbs, the tooth pulp opens and inflammation occurs. Dentin makes up 75% of an adult human tooth. Although it has the same density as bone, it is sensitive to heat and touch. The dentin layer constitutes the main mass of the tooth. Dentin, enamel in the crown. It is also covered with cementum at the root. Dentin is a living structure and 70% is mineral salts. It consists of 20% organic matter and 10% water. Dentin structure contains many canals. The inside of these canals are filled with filaments, which are extensions of the dentin-forming cells at the border of the tooth pulp. If the tooth is cut or reduced for filling or crowning, these canals are exposed and pain may be felt from cold, hot, sweet, and sour. Pulp. Core of the tooth. It contains liquid in its structure. It is the name given to the middle part of the tooth and the soft tissue found there. It continues until the tip of the root. There are blood vessels in this part, and thanks to these vessels, the tooth is protected from infection and always remains active. At the same time, there are hypersensitive nerve cells in the pulp, and thanks to these cells, sensations such as hot, cold, and pressure are felt. Dental pulp, also called pulp, consists of capillary arteries and veins located in a chamber formed by dentin. It consists of sensory nerves and a support tissue that protects all these structures. Cementum. It is a coating that surrounds the tooth roots and is similar to enamel, but softer. Cementum helps root resistance by clinging to the fibers that connect the tooth to the jawbone. It is a bony layer covering the root. It is very thin. It allows the tooth root to attach to the jawbone. 65% is inorganic matter. This video is for informational purposes only. We would like to emphasize the importance of consulting with your dentist to determine which treatment is most suitable for you. If you find our videos informative, please do not forget to like and subscribe. Wishing you healthy days.